Good morning, Dr. Mark.
Morning, Zach.
How's it going?
It's going well.
Great.
I'm glad to be here.
I'm so glad you're here in person, right? We haven't had that much in-person contact, not only just me and you, but everybody, with all the pandemics going on, social distancing, as it should be. I'll let you introduce yourself for sure, but for those who don't know, we have Dr. Mark Cucuzzella. Among your long resume, you're a medical doctor, and you add a lot of value to TrueForm that way. You also own the first, if not one of the first, minimalist shoe stores in the country that only sells minimalist shoes. And not like we have some minimalist shoes, some Nikes. Like, no, you're not going to find a pair of Nikes in your store. Endurance expert, aerobic building base expert as well. So why don't you kind of expand on your resume and how you got to this point?
Short story is, and I'm so happy to partner with TrueForm because I've learned so much from y'all to be able to assess how people's running mechanics are and work together on strength training. So it's not just running. But my day job is I work at West Virginia University. I'm a professor of family medicine there and have a mix of hospital work, and my subspecialty in medicine now is mostly diabetes, obesity, and metabolic syndrome, trying to reverse those conditions.
Great, awesome. And like I said, I haven't seen her a few months, but it was weird yesterday when I picked you up at the airport. I haven't been there in 6 months. I almost forgot there's new structures going up at Bradley Airport in Hartford where we are, and I'm like, wait, that wasn't there last time I was here, but I also haven't been there in 6-7 months. And TrueForm, we're a small company. We travel around. I've been in an airport at least 15 to 20 weeks out of the year. Same thing with Jeff, Rob, and the rest of the team. You travel a lot. You came from BWI, which is a very popular traveling destination from Hartford. So it was normally a packed plane. Like, I'm sure no one was sitting next to you, right?
No.
A completely different experience. So, the first thing that came to mind, and the other thing we brought up too is, we look at the map of places that Connecticut says, when you come in, you have to quarantine, which again, you should, pretty much everywhere in the U.S., right? And so, again, laying the groundwork of where we are today, middle of 2020, what's your thoughts on all this? Bring me up to speed on what's going through your mind, from March till now and even into the future.
Yeah, oh gosh. I mean, it is a disaster as far as just what's happening to this country. I own a small business, and there's so much we don't know. So anything any of us states to be maybe true has huge error bars.
Yeah.
And things are changing every day. So just 2 days ago, the state of Connecticut put up the warnings of travel restrictions coming in, and I wasn't fully aware of that. So if you pull up their map on their state health department now, unless you are coming from Vermont, which is like the one state.
Vermont or like
I think
Oregon
it's Vermont and Maine, and then there's Oregon or Washington. You have to fill out paperwork, and you have to kind of pledge that you're going to go to one place and stay in one place. So we're not going out and partying tonight in bars and kind of repeat on the way out. But that's, if you look at the map of the states, it's 90% red. So, and this isn't the election map. I know people have their sides there. You look at that. But
crazy.
And it wasn't that way in September. But viruses do, especially respiratory viruses. Winter is a time that it should not surprise people that this time it's going up. Would we have predicted that yesterday would have been the highest case number yet recorded? I don't think any of us would have truly predicted that. I mean, people are throwing out all kinds of projections. So that's true. So we do have more cases now. Hospitalizations and deaths are kind of following that now. So that would leveled off, but with this really high case spike, we are seeing more hospitalizations. I don't know the latest statistics on deaths, but there's more hospitalizations, but not as dramatic as the high case numbers. But maybe you could look at it like this, Zach. So, if you had a house on the bayou, you lived down in New Orleans, they've had a disastrous fall, right?
Yeah.
Hurricane comes through. The weak structures go down hard, and some are left, and then the next one comes through.
Yeah.
So the first time COVID went through, especially up here in the New York region, certainly over in Italy, really frail folks, elderly folks. I think the average age of mortality. 80 years old
Yeah.
was like, it was 90% of the people died were like over 80 in Italy. So it really hit these very vulnerable people, hit the care homes really hard.
Yeah.
You know, so that just this past week, there's a care home in Wisconsin. You know, there's tons of cases on the college campus, not a single hospitalization.
Yeah.
But in the care home, they all got infected. And there were like 60 residents of the care home, and 30 of them ended up in the hospital. I think like 16 died. So that's keeping it out of the care home is just critical. But you know, I'm a runner, and you know, most people are familiar with a marathon's 26 miles. And you know, I would have guessed in September we were at about mile 4 or 5.
Yeah.
But I think we took a wrong turn somewhere and ended up back.
Yeah.
So, yeah, because none of us know, right? So I think we're back at like mile 2 now.
Yeah.
I've taken wrong turns in marathons. It's very frustrating.
Sure.
But what do you do when you take a wrong turn? You get over it and you press forward.
Well,
So
that's the
what
thing.
we
Like,
have to do.
you know, I'm a trainer. That's what I do day in and day out. And, you know, if it's strength and conditioning related and even nutrition related, like that's my expertise. When it comes to this stuff, you know, I'm just as clueless as everybody else. I try to stay as informed as everybody else. Who's most vulnerable? Who are the fragile houses?
Yeah, so it's a great question, and again, we don't have complete clear answers, but your odds of ending up, Zach, in the hospital if you were exposed and actually tested positive, you probably wouldn't even have any symptoms. But if we were doing a mass screening, probably at some point in the next year, all of us are going to be exposed enough where we might test positive, and you would be a case, but not an illness from this. Now, I think you have to look at your life and who you interact with. Now, if you have a new baby, an 8-week-old, and if your grandparents want to see that 8-week-old, then you're going to have to take extra precaution to not be exposed and be a positive case, even though you may not have symptoms, because lo and behold, about 90% of the people who are positive have absolutely no symptoms, and you could bring that to, you know, your wonderful grandparents of your new baby on either side, and certainly if they were not uber well grandparents, you know, the age is age, so we can't reverse that. So so it is what it is, and if you're 70, 80 years old, you know, even if you're considered well, you are more vulnerable. So I think everyone just needs to take good common sense precautions. Now, if you were in a bubble, say we were having an athletic competition and they were all well people, 100%, no one else getting in and getting out, I think within that bubble you could probably live pretty normal, because unless there was ways to get it in and out, because no one's going to have symptoms, and even if for some reason maybe one case got in there, the symptoms would be negligible or nothing, and it would, they call it the R naught. It wouldn't spread because the well population, it wouldn't be moving around so quickly amongst them. So, you know, in our own institutions, in our own schools, you know, just good common sense precautions. And each person, it's kind of like this. You know, there's a speed limit, and all of us feel comfortable at a certain speed. Now, if we reduce the speed limit to 1 mile an hour, meaning everyone was like super strict, none of us ever left the house, no one would probably ever get coronavirus, but society and the world as we know it, including education for kids, would just cease, and there'd be depression, economic despair. But if we went 200 miles an hour, there's going to be a bunch of wrecks. So we've seen when people release those brakes too quickly, that's when, you know, the college campuses, that's when things tend to go the wrong direction really quick, and then by the time it's out of the barn, you can't catch up with it.
For sure. So when do we need, what are the markers, or what do we got to look at to dial back that speed, right? To stay on the speed limit. There may be a speed limit sign, but what is that speed limit sign?
Yeah, I mean, I think we have to follow public health guidance and look at, so in our state, you know, we have different colors. There's like light yellow, there's like orange, gold. So when you look at the percent positive of the test you do, so if you have a very low percent positive of the test you do, you know, then it's suppressing. If that number is ramping up high, then it's circulating more. And you can also look at that as positive cases per your population, because that counters in how many people are you actually testing.
Sure.
So most states will have both those numbers, percent positive of tests and percent positive of 100,000 population, and you put those two together and you get a general trend. Are we going this way, or are we going this way? But what we've seen is when we go this way and people say, oh, like you go to a rally and everyone's they're Sturgis, right? Gosh, it's crazy how many cases they have traced to Sturgis.
Yeah.
So but again, people are getting, COVID fatigue, and they want to go out and be normal again, and businesses want to open. I own a small business, and I've colleagues who've had to close their business, mostly restaurant businesses, because eating out is different than going, we might have 2 or 3 people in my shoe store at a time, we're all in masks, but that's different than dining, for 2 hours with your mask off and laughing and talking across the table. And now we can't eat outside because it's starting to get cold, unless you got those really nice heaters. So it's very interesting, and supports your small businesses if you live in a small town in some way.
Yeah, no, 100%. I mean, in the fitness industry, I have a number of friends and family members who lost their businesses as well. Gyms closing down. I mean, you really don't have much of an option. I mean, online training has become a huge thing, but nothing kind of replace that in-person training and in-person relationships. But what action steps can we take now, right, to either kind of reverse some of the possible quote-unquote damage we might have done to our body, or enhance our health, physical fitness?
Let's go back to who is getting in the hospital and who is dying.
Sure.
So when you look at the numbers, then we got to figure it out. You can connect the dots going backwards, as they say. So the people that end up, and we just published an article in the Clinical Journal of Sports Medicine on this topic. Dr. Maffetone has also published on it. So hypertension, diabetes, obesity, cardiovascular disease, they're the top 4 of what they call pre-existing conditions, comorbidities when you read the paper. And so if there was actually a really deep report out of France of all of their ICU stays, and only 1 in 10 people who made it to the ICU, meaning that sick, was not obese. Okay. So obesity is really kind of coming up. So how are all these conditions connected? And so the condition that connects these all is called insulin resistance. So they're not all different diseases. So this is the state of poor metabolic health.
Perfect.
And so to describe for the folks watching, so what is this insulin resistance, and how does this affect COVID? So when I was young growing up, most people were pretty well. Yeah. I would say, you were a well person, right? I'm 54. Most people my age are on 5 medications. Knock on wood, I'm not on any medications. So it's an anomaly now to be well. And actually, a report 3 years ago, a really well done report, it's quoted all over the literature now. So when they look at the markers of metabolic health, there's 5 markers that we consider the metabolic syndrome. So how many people in America now have none of those, right? That would be well. And that's scary is 12%. So 88% of adults in our country have at least one of these markers. And if you're watching, you could pull up on your phone your MyChart or something and get a tape measure, and you could do all these. And you need a blood pressure cuff. So for one would be, do you have high blood pressure? Marked 130/80, or if you're on medication, you have it. So get a home blood pressure cuff, see what that is. Do you have high triglyceride? So triglycerides are packaged in our liver by a condition called insulin resistance. So our liver becomes overstuffed, mostly from junk food, simple carbohydrates. So that's kind of the pop-off valve, is these triglycerides. So they start packaging triglycerides once that liver gets overstuffed, and it's packaging them to go onto your belly. So along with the high triglycerides is a waist. And a simple measurement you can do is tape measure around your belly button, do a little do-si-do, and 2 times that waist should be less than your height. Okay. So I know everyone's going to go try that. So, and 2 times your waist should be less than your height. But another way, if you're walking into a wall and your belly hits the wall first, you got a problem. And most people just know, are they in apple shape? If you're getting that apple shape, you probably got it. You don't need, and it's not BMI per se, because BMI, you could, yourself, Zach, you're more muscled than I am, so you're going to have a higher BMI, and if you're even more muscled, you may even be categorized as obese by a BMI, which is just a measure of height to weight, but it's really height to waist is what we worry about. It's a low HDL. Now, it's kind of short-sighted to call cholesterol good or bad cholesterol, but HDLs have a role in scavenging up the triglycerides, so they tend to go together. People that have low HDLs are at high risk of cardiovascular disease because they have this insulin resistance syndrome, this high insulin state. So low HDL, high triglycerides, waist, blood pressure, and the final one is a blood sugar before you get diabetes. I have a glucometer there, so is your morning fasting blood sugar greater than 100? Or if you've actually been diagnosed with prediabetes or diabetes, you're clicking that off. So if you have all 5 of those, you are at extreme risk of ending up you know, the 6 foot distance that none of us want is 6 foot under. So
Yeah.
your odds of that go exponentially high.
100%. And let's kind of backtrack and even take a step forward with kind of break down the immune system for us and kind of what are the basic components and each of those components that you talked about, you know, what's something we kind of do on the daily, monthly, even yearly track to get on the step to a healthy living?
Yeah, it's a great question. And it's the perfect follow-on, because if you have insulin resistance, high insulin state, your immune system is dysregulated. It's not functioning optimally. And these are like the armies that come in, you know, we're all exposed to things every day, and we want that. We build our immune system by constant exposure to small doses of things, and it's called hormesis. That's why you want your kids to go play in dirt.
Yeah.
You know, I don't know what's going to happen in 5 years that we're basically hand sanding these kids' lives. They're not exposed to anything, and they're not even going outside. Being outside exposes us to different everything, right? And that builds our immune system. So there's a couple branches of the immune system. So there's this immediate immune system called the innate immune system. So that's you get exposed to a virus, and that's the immediate armies, right? You got a snotty nose and a cough. That's all that kind of coming to work. We have B cells and T cells. They all have a little different function in the immune system, but they're working together as a functional army to identify and kind of contain and then ultimately eradicate the virus. Then we have what's called an adaptive immune system, and this is later stage, and this is what vaccines are ultimately trying to do, is develop this, if you've been exposed, like say chickenpox, you got it once, you know, our body develops an immune response to this, and you know, people are talking of herd immunity. At what level of exposure are we going to develop the antibodies that our innate immune system, late stage, will respond to us if we're exposed? So insulin resistance, there's an article in Nature in 2019 defining this in the state of our immune response in the state of insulin resistance. This is pre-COVID, but it's dysfunctional. And the other thing that happens is we've heard on the news about this cytokine storm. You know, the cytokine storm is kind of like you got a log on the fire, your immune system's doing its thing, or the house is on fire. You know, Boris Johnson in the UK had the cytokine storm. He ended up in the ICU, and you look at folks, you know, on the news who end up in the ICU, and they all tend to look alike, right? They all have a little belly, and Boris Johnson has made obesity now a national priority because he's taken it seriously and has assigned a whole commission. And I'm not seeing that happen in our country. So why aren't we talking about this? Kind of is baffling to me. You know, every day we're talking about cases, we're talking about the state of the vaccine, and we're talking about drugs that for the most part are not that effective. I mean, you're talking minimally effective, you know, big cost and huge side effects.
For sure.
So we're not talking about how to build our own resiliency to this because, again, this is a long, hard winter. You know, this is mile 2. So we certainly want to be working those sides, develop new therapeutics to treat it, immunize, but in the meantime, if you're out there, what can you do now?
Exactly. Yeah.
Get healthy.
And how can we get healthy? Like, you know, and that seems like a very broad question, but let's kind of bring it to like nutrition and insulin resistance, right? Like, is it an education gap? Like, I mean, I know how to eat healthy, right? You know, but I'm also knowledgeable in that field because that is my field. But, you know, maybe some of your patients or people in the community, you know, where is the disconnect?
Oh, huge education gap. You know, most patients I see, whether it's in the hospital, in the stress test lab, who have obesity and pre-diabetes, if you ask them, you know, how should they be eating? And of course they would say, oh, I shouldn't be eating meat or eggs because it's going to raise my cholesterol. So they're still following, you know, dietary guidelines and food pyramids, which have, you know, 50 to 60% of their daily nutritional intake being carbohydrates. And carbohydrates are the biggest food driver of this insulin resistance. That, along with the vegetable oils, you know, our grandparents would never think of using corn oil. They had butter, olive oil, you know, maybe some good lard. You know, that was a delicacy. No one threw that stuff away, and that they would cook in that. Those are the natural oils because the vegetable oils also can oxidize and inflame our liver to make us more susceptible to the sugar. So it's really kind of the trifecta of wrecking the liver, which will lead to diabetes, is added sugar, which we do every day to children and free school lunch programs. 6 teaspoons of sugar in 1 carton of chocolate milk, and they get 2 a day because it's delicious. and they are allowed to do that via the government dietary guidelines.
Yeah.
It's nonsensical and baffling that we do that. So it's the added sugars, and there's like 100 names for sugar.
Yeah.
So if you don't know what it is, you better start reading labels, or just get food that doesn't have labels.
Yeah, exactly.
So
That's an easy way to do it. I mean, you got to be
labels.
careful with food labels too, because as you mentioned,
It
there's
should be a warning label.
a bunch of different sugars on there. It might say there's only 2 grams of sugar, but
If
you look
pick up
underneath.
an avocado, there's no added sugar.
Exactly.
Pick up an egg, there's no added sugar. And the other is processed white flour. So how many patients every day, they say the whole grain bread is good. And if they have, this is a continuous glucose monitor here, and any type of sugar is going to raise it, including fruit. So I showed Robin my tracing this morning. I came back from a run and there was a nice banana there, and I was a little bit hungry, so I ate the banana, and my sugar went from 80 up above 160 just like that.
Yeah.
Just with that banana, really quick. But I have an issue where I don't make enough insulin, so for my medical condition, I keep it super low. So, but you always try to test yourself a little bit.
Yeah,
Because you're like, let me see. I mean, one
Push the
little,
boundaries.
so it's like death from 1,000 paper cuts, but they still think that whole wheat bread that they get at the grocery store is healthy, but it's all refined. It'll say enriched, but all they need is a glucometer, and it would show what would happen to their blood sugar. So they would need, I have tons of patients wear these. And
I was going to say, is that a great test to possibly go on Amazon or get a glucose?
You need to get a prescription to get a continuous glucose monitor, but anyone can go get a glucometer. This is just a standard glucometer. And everyone has seen these, and these cost $9 at Walmart or Amazon.
Yeah.
And all you do is put a little strip in, stick your sugar, and do your own test. So every person out there should be the leader of their own healthcare team, learn their response. So it's all the white stuff, all the flours, even if it says anything that says heart healthy, whole grain, organic. If it's a bread, it's still bread. Our liver doesn't really care what it is. The fruits are also going to be sugary, but they have some fiber, so people can tolerate fruit in a different way depending on the person. Check your sugar and the oils. So the processed, refined, fake oils. These are things made in factories. So if the oil that you're cooking with is made in a factory, and these are highly heat processed, they have hexane and different additives. So these are really toxins. So 3 toxins: added sugar, white flour, and the oils. So that's the nutritional side of it. And eat real food. So what it really comes down to is eat real food, things your grandmother would recognize as food. So you don't have the insulin resistance syndrome. Your body can process carbohydrates. You're athletic, have good muscle mass. We only have 1 teaspoon of sugar in our bloodstream. So that banana had 6 teaspoons of sugar. So you wouldn't have that same response. So you might, and it's good. So for you after a workout, have some banana, but for patients with diabetes, no, they can't. They can't have it. So eat plants and animals. If you have a problem with sugar or insulin resistance, those plants need to be the non-starchy plants. Most plants now that kids would consider in the fruits and vegetables are GMO. They're modified to be deliciously sweet and starchy. So they could be super sweet fruits, potatoes, corn, a lot of beans. These are starch. So fruits and vegetables are not all the same thing. So that's on the food side. Cook. I think it's an opportunity now with COVID for people to relearn cooking, you know? And people get meals through their car window. I mean, maybe get some takeout from your local restaurant trying to stay alive, but cook at home, go to some local markets. Exercise is powerful. We'll just call it movement and activity. That's where, your company, Trueform, is just in a super place now, because you bring home a Trueform into your house, and it's very safe. The kids can run on it. They have a blast because it's curved and there's no buttons, so you don't have to worry that little Junior's going to stick his finger in the socket and start the treadmill, right? Because kids could start pushing buttons.
Kids are oftentimes the best runners in the Trueform.
And they can't hurt themselves, right? It's going to self-regulate. It's just a natural feel. And if you're going to move and you're going to do home workouts, you want to work on your skill, not just, I want to go burn calories today, or, just get a workout in. No, you want to, gosh, it's a great opportunity to, just like if you're going to lift some kettlebells, you're going to nail down pick your favorite exercises and really master your technique of those exercises. But if wheel it out so it's nice, wheel it out onto the porch if it's a nice day. But unfortunately, the gyms are probably just not the safest place to be right now. So you better I have a home gym. I have a Trueform at home and kettlebells at home. So that's all I need.
It's, really all you need.
It's all you need. So, and a couple other things that people don't talk about that much with the immune system are stress. So some of it we can avoid and some of it we can't. So there's a little good stress that exercise every day, doing good work. But yeah, right now if you're a single mom trying to Zoom school 3 kids and then do telework from home and trying to pay the bills, that is stress.
Yeah, it's a lot of stress.
Yeah, and that does stuff to our immune system that we don't fully understand. So look for help, get help if you're out there and ask friends for help. I think purpose, because by you asking a friend for help and they helping you, you're helping that person too, because we know that purpose actually helps people's immune system.
Yeah.
So that person you're helping out. Sunshine is powerful for the immune system. Is it related to vitamin D? I think a lot of people have been reading about vitamin D. If you have low vitamin D level, you're more susceptible to severe COVID. Now, do people who aren't in the sun just happen to be sicker, or is it just the vitamin D level? Maybe a little of both. But so go outside, get sunshine, make sure you know your vitamin D level so you can supplement, especially wintertime. I supplement vitamin D in the winter because you just can't. I run at 6 in the morning and there's no sun.
Yeah.
So, but in summertime, I'm trying to get out there, even early morning sun. But the midday sun is the most powerful. So if you can take a walk at lunch now because you're not at the office, you're on your Zoom calls. And then the outdoors actually enhances our immune system. So just by, it's nasty weather, really cold, get on the True Form inside, but get outside. We're seeing this kind of resurgence now. I mean, all of the running events are shut down,
canceled,
like you come out to Harpers Ferry, West Virginia, where I live, and like I'm not comfortable down there now because there's too many hikers.
Yeah.
So I go pick the trails nobody knows. But it's like all Shenandoah, it's probably similar in Colorado trails or maybe even up this AT in these sections. There are people now discovering the outdoors and trails, which is all good. Just make sure you're safe precaution if you're in big groups. Pass people with respect. Wear a mask. Some people, if you're ever at an overlook, I think just more out of respect for other people. Sleep is also
for sure
powerful modulator of our immune system. So maybe people are getting a little more sleep now that they don't have to commute.
Yeah.
So those, look and kind of train for your weakness. So which of those you need help with? My sleep apnea in these folks who have metabolic syndrome is really, it's really severe and it's unnoticed for the most part. Most people don't know they have it. So if you have metabolic syndrome, if you're a guy and you've got a 17-inch neck and you snore, you better get tested for sleep apnea because that raises cortisol.
For sure. So what I take from that is the action steps of nutrition, right?
Nutrition.
So shop the aisles, look for foods with no barcodes.
Stay away from the aisles. Shop the perimeter.
Shop around the aisles. Perimeter is I mean. Yeah, don't shop the aisles.
I don't know what's in the middle of the grocery
We'll bleep that out, but shop the perimeter of the aisles.
You have to get diapers now. So.
Yeah, I got to get diapers. I got to the aisles once or twice. So nutrition, what your grandparents would eat, whole foods, right? Don't be afraid of fats, butters, get the right kind of oils, olive oils. Don't be afraid of meat as well. Lower your stress as much as possible. Obviously, there's going to be plenty of stress in life, but, you mentioned, movement. Movement's a great way to de-stress. Get it, when you're done with your Zoom call, go for a walk, right?
Stand-up desk, too.
Stand-up desk.
Set up in your home. Don't just...
Exactly, because then we get into poor positions. But whether you're walking in a True Form or getting outdoors, if it's sunny out, get that vitamin D. We're getting into the a little bit colder season, but no reason why you still can't be outdoors. Anything I missed?
No, that's the message. So we've run away from the virus for the first 7 months now, right? We're trying to run away, but we're going to actually need to go out and gently expose ourselves again. So now is the time to take action and build we call it kind of physiologic headroom. So everyone out there needs to build their own reserves. And again, of course, protect all those people that are just prone to get sick.
100%.
But it's we need to take this seriously as a country. And, the economic downside of more lockdowns, which is happening now in Europe.
Yeah.
I mean, people are protesting in the street now. So if we weren't such a sick society, so if this was in the 50s, I don't know, maybe we've had pandemics of different viruses, but never have we just shut everything down like this.
That's
and
tough.
Is it a worse virus, or are we just a sicker world?
Yeah,
I don't know.
Combination of a lot of things for sure.
We don't know.
All I know is we have these actionable steps.
Yes,
Easy stuff we
get
can do.
healthy.
Right? Get healthy.
Have fun, enjoy,
eat, sleep,
and
work out, move. Thank you, Dr. Mark, for coming today. A lot of great information. I know some of you at home might be taking notes, and some of you might not be, but don't worry. All this is on livetrueform.com, L-I-V-E, then trueform.com. We have a free library of exercise tips and drills, nutrition tips, as well as recipes, really all laid out for you. Everything Dr. Mark talked about today, this is where this interview will be as well. And so all the resources are there because, our goal, my goal, Dr. Marker's goal, Trueform's goal, and what we talked about today is just taking these actionable steps, easy actionable steps, and putting them into our daily lives. So thank you.
No, it's great making the information available for folks.
Oh, for sure. So livetrueform.com, and don't be afraid to reach out if you have any questions.